Biliary atresia is a rare liver disease that occurs in babies. It is present in about 1 in 14,000 live births, so that gives you an idea of how rare it is. The disease is thought to start while the baby is still inside the mother's womb, and it involves a progressive damage, inflammation, and scarring and blockage of the bile ducts in the liver. The bile ducts are very important because the liver makes bile, and the bile ducts are the tubes through which that bile is transported to the gut, where it's important for breaking down fat and helping you absorb vitamins. If the bile ducts are blocked, which they usually are by the time the baby is born, the baby will present with jaundice, look yellow because the bile can't get out of the liver. The bile that's in the liver will cause progressive damage to the liver. And because the bile is not reaching the gut where it should be, the baby can't absorb fat properly, so it doesn't grow, and isn't able to absorb many of the important vitamins that can cause problems with bleeding and bones, mineralization, and lots of other issues. The cause of biliary atresia is not known. We don't really know who gets it or why. There are some theories about an infection followed by some sort of uncontrolled inflammatory process that isn't able to stop. There is much research around the world trying to find the cause of biliary atresia, but as yet, unfortunately, nobody knows. Because biliary atresia is not an inherited condition, we know from research all around the world that if you do have a baby with biliary atresia, you are almost certainly not going to have another child with biliary atresia. Biliary atresia, because it presents very early after birth with a baby with jaundice, that's usually the first clue that there is something wrong. So if the baby is jaundiced, a blood test is done to show what type of jaundice it is, followed by some tests including an ultrasound and perhaps a biopsy of the liver. That's where we take a little small sample through a needle of the liver and look under the microscope at it. Sometimes we have to do a special X-ray called a cholangiogram, and together these pieces of information will help us diagnose biliary atresia. The treatment for biliary atresia is somewhat urgent. We need to diagnose and treat it as soon as possible. So once the diagnosis is made, hopefully within a few weeks of life, the first treatment is a special operation called a Kasai operation, which was developed in Japan in the late 60s. The operation involves removing the damaged bile ducts and connecting a loop of bowel to the liver with the hope that some of the bile ducts that are still in the liver and open will allow bile to drain into the gut. This operation works reasonably well in about 50% of children. In the group of children where it doesn't work, they are likely to need a liver transplant within the next year or two of life. In the children where it does work, that can enable them to grow and go to school and lead a reasonably healthy life. But we know that most children with biliary atresia will need a liver transplant before they reach adulthood. Apart from the liver transplantation, and while the child is growing, we will supplement the child with special feeds to enable them to grow and multiple types of vitamins to prevent bleeding and to allow bone growth and eye development, etc. Life with a baby with biliary atresia is difficult and it's quite challenging. It does involve being closely attached to a fairly major hospital with paediatric gastroenterologists and other specialists who will help manage the child. There may be additional feeds required at home, special formulas, or sometimes if the baby is not drinking well, we need to put a little tube through the nose and into the stomach and feed the baby through that tube. This difficult journey has been travelled by many families, so there's a lot of information and a lot of resources and support out there for families with biliary atresia. I would suggest the Liver Foundation website has information on biliary atresia. There's also information available on parent support groups, of which there are some in Australia and the US. And there are also some multi-centre collaborations both in Europe and in America